Thank you, Professor Barbara, and thank you, Dr. Curtis, for a very quite interesting lecture. I have learned a lot. My name. My name is Dr. Brooke Hailubesha. I'm an adjunct professor at the Elliott School of International Affairs. I'm an African. I come from the eastern corner of Africa, from Ethiopia.
Ethiopian.
Yeah. I don't know what.
I recognize the accent.
Okay, thank you. And I'm glad to hear that you have done something in my country in your lecture. And I teach African security-related courses and conflict management and the like here. And I was a former diplomat stationed in Washington and in the United Nations. Now, I have a couple of questions. I'll be very quick. And that is, as far as I know, there is an annual event, hand-washing annual event organized by the UN, specifically maybe the UNICEF. How far are you succeeding? Because awareness creation is decisive in such matters. And also government should also focus on such issues using the media like radio and TV and flyers so that the people, especially living in rural areas, could focus on this and could change their life and learn something. And how many countries are participating? Is it declining or going strong or declining? Second question is, when it comes...
Okay. I was here in Washington a year ago for a meeting a bit like the one I'm here for now. And that was when we hatched the Global Hand Wash Day idea. So that was in February a year ago. It happened in October last year. So in the 6 months, we got 85 countries having massive events on hand washing. So for example, every Yemeni who has a mobile phone got a message about hand washing on October the 15th, about how important it was to wash hands. In the UK, we did a study of commuters' dirty hands. And it was really a publicity stunt because what we found was men in the north of England had dirtier hands than men in the south of England. And the press got hold of it because in England we have a big debate about north-south and who's cleaner. So we got. I think I did 40 interviews the day and the day after on Global Hand Wash Day. We designed it to be a hook to talk for the press to talk about hand washing, but also to get people thinking, hands. 50% of people have toilet bugs on their hands. So. I think if you use Google, we use Google Alerts to check how much coverage there was, and there was deluge of global coverage for Global Hand Wash Day. So it was an extraordinary success. Everybody, it was fabulous energy that everybody got behind it. Procter & Gamble, Unilever, UNICEF, all of the big agencies, the bank obviously helping to coordinate it. So we're now starting to talk about what to do next year. The event in the UK is going to be the Poo Oscars. So we're going to have award golden poos to people who've done things for sanitation and for hand washing. And also there's an animated film competition. It's going to be in association with the British Film Institute when they have their annual animated film Oscars. So that's one of the things we're going to be doing. So we're looking for, if anyone's got any good ideas, if anyone's working in any countries and wants to get involved, we Global Hand Wash Day, October 15th every year. We need volunteers and support. Everybody. It's been a great success. Yeah.
Thank you both for your questions. Sorry to cut you off, but there was a person in the back.
Hi, my name is Ellen Walter, and I am a MPH candidate in the Global Health Department. And my question actually has to do with the support of the government in the countries that you're working in, and whether or not you find that with lack of support, or how necessary is the support of the government in order, or the Ministry of Health for that matter, to make the reduction significant?
Yeah. No, it's a very good question. I skated over that rather because of time constraints. But in every country, we aim to set up a partnership in that country, and usually it's hosted in the Ministry of Health or the Ministry of Education. Because schools, I didn't talk much about schools, but school hygiene and health is a key component of many of these programs. So it takes a bit of time to get them excited and motivated to get involved with it. But it's been getting easier, and we're finding now that governments on the whole will buy into this. You know what the capacities of governments are in developing countries. There's terrible limitations of resources, of human resources, of even basic knowledge about how to do simple campaigns. And so having that link with the private sector has been quite important in making it interesting and exciting to the governments to get involved with it. It gives them, and it's been exciting for the soap companies as well, because they get to know the governments better through being involved with these things. So yeah, governments are obviously absolutely critical to these partnerships, making them work, and they're key partners in all of them. We couldn't do it without.
Hi, my name is Milana Uretsky. I'm an anthropologist, faculty in the Department of Global Health. My question is about infrastructure. So you talked a little bit about sort of physical infrastructure, and I was hoping that you would address it more, because you talk a lot about soap and the availability of soap and water to wash one's hands. But in a lot of public toilets in most of the developing world, there is no water available outside of a public toilet. And it's not just a matter of running back to your home. You're out and about in the city or in your village, and there's no water available. So I'm wondering how far your campaign goes in addressing these infrastructure problems.
Yeah, I mean, really good point, because clearly, a campaign that might last a year that uses mass media isn't going to have a big impact on a country where only 20% of people have taps in their homes. On the other hand, it's very rare. Madagascar, again, and Ethiopia is something of an exception. People do have water at home. And most of the defecation events are, Ghana is exceptional in that people use public toilets a lot, but in most of the developing countries, people are defecating either at home or in fields. They're close to home. They have latrines in their homes or going somewhere fairly local. So I didn't present the data, and it depends how you measure water availability. I mean, it was measured differently in every one of those surveys, so it's hard to actually give you an exact figure. But people did have water available. They were using it for washing clothes. They were using it for washing dishes. And it's perfectly feasible to keep a bowl of soapy water that you've used for washing dishes to wash your hands in, for example. So people can't live without water. And it's very easy to make the perfect the enemy of the good in these sorts of campaigns. You might say, we can't do these campaigns because people don't have water. Well, then we go away and forget about it. Most people did have water. There are exceptional difficulties in remote rural areas where water is hard to come by. But this sort of caricature of the sort of the African woman who is spending 5 hours a day collecting water, pretty unusual. Not really the norm in most of Africa. I'm sure you'd agree with me, even though Ethiopia is one of the most water scarce countries in the world. People still have water at home, don't they? But I do feel sorry for Ethiopian women, because the men have obviously built the houses on tops of the hills, and the women have to walk all the way down to the valleys to get the water, and often it's a very long way in Ethiopia to bring it back in a pot on your head, a very heavy pot on your head. So, yeah, water scarcity is an issue in some places, but the vast majority of countries is not a problem. But it's not a killer problem, let's say. It's a problem.
Abraham Abidor, formerly with the Foreign Service. Given the risk involved in your media campaign, do you discourage people in developing countries, especially, but maybe also in this country, from shaking hands and casually hugging and kissing each other? Because clean people this way may get infected from people that are not observing all the good hygiene conduct that you recommend. Thank you.
Yeah. Most of the work I've done, and I've tried to focus always on developing countries rather than in developed countries, because the total in Africa, 65% of all deaths are infectious deaths, whereas in Europe and America, 5% of deaths are infectious deaths, and a tiny proportion of those is due to poor hygiene. So I'm really not so worried about hygiene in America, and I'm not worried in the UK, and I'm perhaps in hospitals. Yeah, hand washing in hospitals is an issue. So the question is, can't people contract diseases from each other by shaking hands or kissing? Yes, theoretically, I could fall under a bus tomorrow. The evidence says that the most important route for the transmission of fecal bugs is not washing your hands after the toilet. That's the super highway of transmitting the diarrheal diseases which are killing 2 million kids a year. If there is an epidemic of flu or casual person-to-person contact is not a major source of death as far as we know. So we're not suggesting people shouldn't shake hands. I had a journalist ask me what Obama should do when he came to when he came into power. Should he be shaking hands with everybody, or should he do what George Bush does, which is carry around a little thing of alcohol gel, and which he always used to wash his hands after he'd shaken hands with people. And my answer for the journalist was, if Obama wants to be seen to be a man of the people, he certainly should not be seen to be going around with a little. He shouldn't worry about his health. He's not going to catch anything dangerous. It's a difficult one.
Hi, I'm Allison Brooks. I'm an anthropologist in the Department of Anthropology here, and I've worked most of my life in Africa, particularly in the drier countries, but also in the Congo, and also in rural China. And I very much admire your initiative, because there's a lot of diarrheal disease and death in all those places. On the other hand, not only is water much scarcer than your statistics would suggest, at least in my experience, and women spend a much longer time getting it. It doesn't exist in the house. But it's often not clean water to start with. It's water. I mean, I think of the water that the Maasai, where I'm working now, are washing in every day, has both them and thousands of cows defecating in it all day. It's the most disgusting water you could ever imagine. And yet everybody's washing themselves in their clothes. It's the only water they have. And I'm wondering how this problem factors into your efforts.
I still think that
Does soap make it clean?
we as anthropologists have a somewhat distorted view. The majority of the African population, it may be 10% or 5%, depending on how you define water scarcity, have water within reasonable. You can't live without water. You've got to have water for drinking, for bathing, for cleaning clothes, for doing your. And so yes, there is in the most water scarce areas, in the most poor areas, it's very hard to do any development. It's very hard to do anything for anybody. But I'm not going to let that mean I don't do something for the 90% that can benefit from that. What I do for the 5 or 10% that have a problem is I advocate very strongly for improving the water supplies in those areas, and that's going to take time and take money, and it is happening. The Millennium Development Goals for water are going to get met. What I'm actually much more worried about is the sanitation goals are not going to get met, and 40% of the world is still waiting for the toilet, and that is the source of the fecal contamination that's making people sick, and it's causing. And if we can get rid of that fecal contamination and everybody wash their hands with soap, we'd get rid of diarrhea completely. In fact, water is not so important in the transmission of diarrheal diseases as the sanitation is. So my big battle really is sanitation rather than water. I do argue on that. But I mean, yes, of course, there are places where this isn't going to work, and it's very difficult to know what to do for anybody in those very poor, any development activity is very difficult in those poorest of the poor. Absolutely agree.
We're going to hang in here with Q&A till 5:30, and then open the doors for the reception, and then you're free to let me know Val for one-on-ones. Yes.
My name is Naika Gabriel here.
Hi.
I'm a student in the Elliott School, and my concentration is global public health. And I was wondering, how important is epidemiology in your field of work?
When I was an engineer, then I was an epidemiologist, then I was an anthropologist, I suppose. So the data we presented at the beginning on the meta-analyses, that's epidemiological research. The trials that my colleagues and I are trying to do are epidemiological research. So we've got a couple of trials going where we've got a control group and an intervention group, and we're giving hand washing to one group and not to another group, and looking at the health outcomes. Actually, that's epidemiology. Actually, what I'm more interested in is I think we know now that hand washing prevents diarrheal disease. So the health outcome's not so interesting. I'm interested in the trials where the outcome is actually just hand washing. And not many people do that. That's not really epidemiology, which is one of the reasons we have trouble getting these trials funded, because it's not standard epidemiology, it doesn't have a health outcome, it just has a behavior outcome. So it's inspired by epidemiology, but it's not actually pure, traditional epidemiology. Some of this is quite pure psychological research. It's not epidemiology. But yeah, I'm in a school of public health, and it's the fundamental discipline that all my colleagues use, and they find our stuff a little bit weird, but I still think it's important. Yeah. Right.
Hello, my name is Abdul. I'm a student here at GW and also program assistant for SIGA. My question is actually very simple. What kind of soap do you use? Because in the West, we have that jaded view of antibacterial soap and just beauty soap. There's various types of soap. There's like 98% antibacterial, 99%. What kind of soap is being used?
Well, one of the studies that I showed at the beginning in the meta-analysis is done by Steve Luby, who's a very famous hand-washing epidemiologist. He works it's a big study in Pakistan. It's funded by Procter & Gamble, and Procter & Gamble were trying to show that their antibacterial soap was more effective than ordinary soap. So they had 3 arms in the trial. One was just a plain white soap, one was an antibacterial soap, and one was a control group that didn't do anything. In the control group, diarrheal diseases was high and stayed high throughout the trial. In the 2 intervention groups, the antibac soap and the ordinary soap, diarrheal disease dropped rapidly and disappeared, and there was no difference with the antibacterial soap and it was to the credit of Procter & Gamble that they were quite happy that study got published and and everybody learned about it. So there's very little evidence for an increased health impact from antibacterials in soaps. Why do companies put them in the soaps? Because consumers ask for them. Consumers say, I want to be protected from germs, so I want a germ kill in my soap. It's one of the things that's on the list of what consumers want from soap. So the soap companies give it to them. But actually, the benefits are probably negligible, probably not damaging, probably not causing resistance or anything like that, probably not doing any harm, but probably not doing much good either. But it makes people feel safe. It makes people feel that it's worth using the soap. So if it makes people use the soap more, then I'm for it, then I don't mind having antibacterials in the soap. Does that answer your question?
Val, I want to thank you for a wonderful talk, informative, inspiring, memorable, not just because it was probably the first talk in the Elliott School that concerned fecal matter, but you have brought Disgust into the Elliott School. I wasn't going to say that. BBC may be here. In a programmatic policy relevant sense, you've blended psychology, anthropology, epi. You're just a Wonder Woman. Thank Val with me. Thank you.
Thank you.